An Introduction to Gout. What is it all a gout? Still can't get through that sentence. What is gout? Gout is a form of inflammatory arthritis with distinct characteristics. It manifests through acute attacks featuring intense pain, redness, swelling, and heat in the affected joint. These symptoms typically emerge during the night, reaching their peak within 12 to 24 hours. The pain is excruciating, prompting many individuals to seek emergency care, contributing to gout surpassing rheumatoid arthritis in annual hospital admissions for rheumatological conditions. The underlying mechanism involves the crystallisation of urate, a byproduct of urea metabolism within the joint. Either an excess of urea in the body, constituting about 90% of cases, or a diminished ability to produce urate, triggers the formation of these crystals, sparking synovitis and the associated symptoms. When the joint is aspirated, the presence of urate crystals becomes evident, confirming the diagnosis. Who gets gout? Gout impacts approximately 2.5% of the population, but exhibits geographical variation, with higher prevalence noted in the northwest of England and Wales. The gender distribution reveals that about 1 in 14 men and 1 in 35 women are affected, emphasising a higher incidence in males. And notably, onset before puberty in men and before menopause in women is extremely uncommon. The first metatarsophalangeal joint, or the first MTPJ, stands out as the primary target for gout, constituting 75% of cases at initial onset. The joints affected then move proximally, with the midfoot and ankle the next highest affected, followed by any other peripheral synovial joint. The more attacks that occur, the more likely that other joints and or multiple joints can become affected. Beyond demographics, gout is intricately linked to various comorbidities. Conditions such as diabetes, cardiovascular disease, stroke, obesity, and impaired kidney function are associated with an increased likelihood of developing gout. Dietary habits also play a crucial role, with high alcohol and red meat intake emerging as significant risk factors. The correlation between lifestyle choices and gout highlights the multifaceted nature of this condition, encouraging a comprehensive approach to its prevention and management. Understanding the demographic and lifestyle factors contributing to gout not only aids in the early detection, but also guides targeted interventions and lifestyle modifications to mitigate its impact on individuals' health. So what do we do? In addressing gout, a structured approach is crucial, particularly in managing the first attack and addressing ongoing treatment. For individuals experiencing their initial gout episode, prompt consultation with a GP is advised. The immediate management involves non-steroidal anti-inflammatory drugs, or NSAIDs, and colchicine to alleviate the acute flare, followed by gradual titration of allopurinol to regulate uric acid levels. While physiotherapy yields limited benefits in the early stages, educating patients about the condition, coupled with providing symptomatic relief through measures like ice application and NSAIDs, contributes to a more comprehensive approach. It is worth noting there is currently an ongoing discussion about NSAIDs compared to colchicine to manage acute flares. Colchicine may be associated with more adverse outcomes. For those already on medication, a careful discussion of the ongoing treatment plan is essential. It's common for a gout flare to be triggered by the initiation of allopurinol, underscoring the need for a thoughtful and patient-centered approach. Titration of allopurinol dose is necessary until effective control is achieved, requiring close monitoring. Although primary care plays a pivotal role in most cases, collaboration with rheumatology specialists is recommended, especially in the early stages of the disease and when faced with refractory cases. This collaborative effort ensures a holistic management strategy, combining both immediate relief and long-term control to optimize outcomes and enhance the patient's quality of life.